right now, there's no good ways to automate that workflow. This is a key workflow. It exists across everything. It's all done by hand. And that's the problem we're trying to solve, is to make this a reproducible engine that can drop into the healthcare systems as they exist today. Because the last thing you want to do is try and give nurses and doctors another tool to administer and work through. They're already overloaded with technology. So we're really trying to embed it in the existing platforms that they already use today and integrate it that way.
Hi, my name is Dimitri Panici, and I'm a content creator, agency owner, and AI enthusiast. You're listening to the AI Agents Podcast, brought to you by Jotform, and featuring our very own CEO and founder, Ida Tank. This is the show where artificial intelligence meets innovation, productivity, and the tools shaping the future of work. Enjoy the show. Hello, everyone, and welcome back to another episode of the AI Agents Podcast. In this episode, we have RJ Burnham, the founder and CEO of Consig. How are you doing today, RJ?
Doing well, Dimitri. Thank you so much for having me on today.
Yeah, excited to chat. First of all, let's just kick things off by, getting a little bit of insight as to your background and how you got into AI in the first place.
Oh, so I have like I said, mentioned, my name's RJ. I was founder here at Consig, and I've actually spent my whole career building communication platforms. It's been almost 3 decades working in the field of, as we now call it, voice AI. In the past, it was really called telecom or speech recognition or natural language around it. And it's been kind of fun to spend the career kind of pushing the limits of what's possible with voice.
Yeah, very cool. And you obviously guys are in the healthcare sector, right? So.
Yeah, we've really kind of focused in around sort of the problems in healthcare. And, I really look at, I've spent my career building more platform type companies. And when we started Consig, we started out kind of the mission to kind of understand problems in a couple industries. And time again, we kept coming back to healthcare. And really comes down to, I feel like healthcare is one of those places where communication just sucks, especially as a patient. I'm a healthcare person. I don't come from that industry. I don't come from that world.
Yeah.
And it's been interesting to break into this. But my core piece of, I've been, I sort of joke, a pro level healthcare user. I have a daughter with special needs. I've done a lot of stuff throughout the healthcare system. I've learned to be an advocate and how to fight and follow up and chase things down. But it's way harder than it should. And as I started looking at it with the background of voice, we kind of came to the conclusion that maybe this is an industry where we can actually make it better, and actually better for both sides. One of my frustrations with voice AI and IVR and communications technology is it's usually heavily focused on just doing cost savings for the company deploying it. They always look at, how do I just automate conversations? And healthcare is one of the places where I actually think it really can do a better outcome, both as a patient. And I look through that lens of like, what would I want as being from a technology and communication perspective, and for providers and payers, the insurance companies, the hospital systems around it. Because we have a problem in healthcare. There's not enough nurses, there's not enough providers, and there's a huge labor shortage in this field. And so much time right now that they spend is wasted on the stupidest things. And that's kind of been what drove me to say, hey, why don't we go tackle this and take it on?
Yeah, no, that makes a lot of sense. So what do you think is the way that you guys are specifically handling it and helping the people who are, dealing with these problems out? And maybe if possible, I think a scenario would help. I remember you went through an example scenario on our pre-screen and it was pretty good. So just kind of go into that. I'd love to hear a little bit more about how you guys are helping, and maybe the audience could, benefit from something like that.
The thing that's kind of happened over the last few pieces, I spent at the first stage of the company, basically a ton of time just doing problem discovery. It's amazing. You go and connect with people on LinkedIn and just ask them to talk about the problems and that they see in their business and scaling it. And didn't want to sell anything. I just wanted to learn. And ended up having probably 50, 60 of these across healthcare. And we really started to see a common pattern, which was a lot of time is wasted actually getting a patient on the phone to be able to have a conversation. Maybe this is in post-discharge follow-up after someone's been in the hospital. The nurses usually have a big stack of paper of cases that they're supposed to check in with it. How often does anyone ever get a hold of you in those cases? Almost never. It doesn't happen. Um, Maybe it's in making sure that after your physical that you actually did the exams and pieces around it. Maybe it's an appointment reminder. No matter what you call this, whether it's in home health care, whether it's in telehealth, they all have this same core reproducible workflow around getting a patient on the phone, actually getting them to connect. I don't know about you, but I don't answer most of the phone calls that come into my phone anymore if I don't recognize the number. That's the very first challenge. Add to it, we have things like call screeners and stuff that make it really hard and difficult for automation to make their way through it. We then in healthcare have to make sure that the person we're calling, is it really the right person? Am I really talking to Dimitri? Can I validate stuff before we start sharing health information around the phone? There's a lot of rules and regulations to protect that for a good reason. And then lastly, if I got through all those gates, can you actually talk right now, Dimitri? Where are you in the car? Are you distracted? Is there a better time?
Yeah.
All of that can easily take 3-4 minutes to make your way through. And right now, in healthcare, they have people doing that. They're having nurses do this. This is the most resource constrained person in healthcare, and they're having them do that workflow. And it's crazy. It blows my mind. I come from how you automate and scale outbound calls and go through it. And you go back and say, why are you doing this? We had a great workshop working with Blue Cross Blue Shield of Florida.
Sure. Yeah.
And it was really interesting. They actually know with very high certainty who is going to probably be readmitted into the hospital after an ER visit. They know from the data that if you've been to the hospital twice in about 2 weeks, there's a 50% chance you're going to be going there a third. And if you go there, it's a 50% chance you're going to go a fourth. And it actually goes all the way down to like 5 or 6. So they actually have 100 nurses on staff doing outreach and trying to intervene around this. The problem is when they did the analysis, they see that 60% of the time they spend is doing the wasted conversations that I just outlined. And this is an area where we really want to see and think that we can do and help automate portions of this, because this is absolutely solvable. And let's have nurses, instead of having 15 clinical conversations, let's get them to having 30 and really improve the outcomes. And that's 30 patients that each of those nurses then can have a follow-up with, which before would have been half of that.
I think a lot of people tend to have a aha moment when you talk about these types of things, right? Like I personally, when you discussed it, and as I've done this podcast more and more, every person I have that talks about healthcare issues, truthfully, I think it is so funny that then I just go back to and think about all the different conversations that I've had complaining about healthcare, and the context behind what could be, I feel like is always not actually that, it's not there in the conversation. It's like we're complaining. We don't even know what could be better and what are the issues causing it. And as I've interviewed more people like yourself, I've interviewed a couple of people in this space that are, trying to help out with healthcare. It kind of seems very apparent that, they're struggling for time. And a lot of it's this nonsense paperwork. And you're probably providing one of the first like communication solutions. I haven't had that yet. I've had other solutions where it's kind of like more about helping them with the paperwork side of things and that kind of thing. But this is definitely the first I've seen with the communication, which I think is awesome. So what is your kind of like thought on how necessarily you can do this at a practical level? And what has kind of the reception been like for clients that you've helped out, and kind of like how did you even get a footing in the market in general?
So, the first thing is trying to actually describe the problem the right way, and understand the incentives within healthcare. When I first started working in healthcare, the challenge I realized is they speak, frankly, a foreign language. It's a completely coming in as a non-healthcare person. There's so much terminology to understand, and it's a huge. You also have this really interesting dynamic that there are huge sort of like balancing, I call it like opposing AIs, depending on whether you're selling to providers and doctors and nurses, as opposed to if you're selling to the insurance and the payers. Uh,
Oh, okay.
all these different incentives, and what you really have to ultimately do is ultimately find out what the real impact is and how are they compensated, what is the financial model underneath it. That's a little tough as an outsider. I'll tell you, it's been my biggest challenge breaking into healthcare, is to grok and get around us. And been lucky enough to get some really great advisors who have helped navigate that. But that's the first thing that you need to really do, is actually be able to describe to them why this matters. Because if you just tell them, I'm going to save nurse time and this other stuff, they get it, but it doesn't click. But if you can then connect it, for example, to things like star scores that explain what their reimbursement rates are going to be for Medicaid or Medicare, all of a sudden that kind of pushes in there. I hate to say this, healthcare is very much a business, especially in the United States.
Sure.
It's a little Western. You teed this up. I have had the opportunity to see healthcare in 3 different countries. I have a lot of years in the U.S. system. Portugal, I've seen through it. I've seen it some with Brazil. There's pros and cons to all of them. They have ups and downs. But the U.S. system it is such a machine, financially driven, and I don't know
Well,
how to
I,
fix
I, I would not push back on the sentiment. I think I agree it is a machine and it is a business. I would push back on it's not an efficient machine. I tell you what, like machine kind of implies a machine implies efficiency, which I would push back on, because I have had so many funny experiences where I want to try to not. Okay, how do I word this? Okay, I'm going to be in public on this statement. So I have gone to doctors' offices, and I have a consistent experience where there is a, let's just say, disgruntled receptionist who does not seem to want to help me in any context. And it is a very disconcerting experience when it's about my health. I commonly, and this could just be my bad personal anecdotal experience, but when I talk to people, it seems pretty universal. It's like, and some of me is like, I don't want to blame the person. Maybe it's that they're overwhelmed with too many things, but they don't quite seem to know all the details. And the only thing they do seem to know how to do on a very good level is simply put, ask for your money accurately. Whereas I have family members who've had different surgeries and stuff that have kind of come up. And while I think that it is the onus of the person to make sure that they do their follow-up appointments, the fact that they haven't figured out some sort of like automated, this person had X problem, we should send them a Y automated sequence, just making them feel like we give a crap. About like, oh, hey, you have your sphincter appointment for next year for like your esophagus. Like don't forget about that. Hopefully you're drinking, like you're not drinking as much alcohol. You're eating as less fatty food. Like anything, any follow-up emails whatsoever would be standard in the protocol of attempting to, because if they're going to treat it like a business in the context of wanting to make as much money as possible, I actually think as much as it is good from a personal standpoint, I think it's worse that they don't do those sort of like kind nurturing things that like your standard business practice does on any sort of like recurring sales basis. You know what I'm saying? Am I making sense?
No, absolutely. And listen, there is some things driving changes around portion, elements of that, behind the scenes. And I do think I think we will see improvements in portions of this as things transition. There is definitely an effort to move towards more outcome-based payments for the providers and the insurance elements around it from a reimbursement perspective. But it's tough. But you literally hit right on there, I think, to me, is the core use case, and why I think we can improve outcomes on this is when you go into a doctor and you have your follow-up, nobody ever follows up to go through it. Now, the thing is, when you're sick, you're actually in the least capable stage of your life to be responsible and be thinking about all the follow-up and the things that go through. You're, by very nature of the fact that you're sick, not operating at 100% and thinking about this. And so much stuff just gets dropped and not done because either you're not in a state to do it yourself, or then you forget about it. We're all humans. We all tend to focus more. Yeah, once it drops our mind, those exams and things like that, to go through it. I've had all the time where if someone actually followed up and checked in and had a conversation and say, "Hey, how is it going?" Not just a reminder of texts. We all get texts, we all get emails, we ignore that. We're overloaded with notifications. But I think the core portion is to actually have a conversation. And that's really what we are trying to build. Like I said, I don't we can automate a lot of things, but I actually want to scale and build more healthcare conversations. And that's to me the real
Fair enough.
driver of trying to build is actually get a real conversation between a provider and a patient. And I think if that can happen, we're going to get better outcomes on stuff.
I think that's fair. That's a good thought. I do think the conversation beat, like if I did get a phone call, right, that would make me feel a lot better if then it was an automated email. But even just having something in the system in order for them to automatically have the conversation.
The problem is right now there's no good ways to automate that workflow. This is a key workflow. It exists across everything, but it's all done by hand. And that's the problem we're trying to solve, is to make this a reproducible engine that can drop into the healthcare systems as they exist today. Because the last thing you want to do is try and give nurses and doctors another tool to administer and work through and go through it. They're already overloaded with technology. So we're really trying to embed it in the existing platforms that they already use today and integrate it that way.
And how's it gone so far?
So far, it's been really good. We've really, looked at how we partner with some of the providers around there. We're focusing on specific subsegments. Outside dental is a great place. Dental is probably one of the areas that's the most willing to jump on stuff, and it's actually interesting.
Yeah.
Dental's a little, it's actually a reoccurring revenue business. When you
absolutely, because you have to go back.
Yeah, and actually it is, and actually it's churn. If you miss an appointment, you quickly become churn. If you cancel your appointment, the odds of you actually rebooking another one goes down tremendously until you have a problem. And then you would come back in on my 2/3. Now you go back and get back into the system. And it's actually funny. I've actually noticed this. The efficient dentist office, actually, they now book your next appointment before you ever leave the chair. And I haven't talked for sure, but I'm pretty sure that's from operationally of getting you back in, making sure you get your 6-month appointment and keeping you in the system around it. So it's been interesting. Dental is one of the places I've seen the most adoption of technology and thinking about it almost the way we think about software subscriptions and stuff like that.
Interesting. Yeah, no, that's fair. What do you think is the, actually with dental stuff, yeah, just to kind of follow up on that, I actually said something funny, which is like, it's kind of a required recurring thing. I feel like it's from a technical standpoint, no one has to go to the dentist. But they kind of get you on a recurring model by being like, well, when are you going to schedule your next thing? When are you going to schedule your next thing? Which I do feel like in some cases with specific, like just to talk with my personal experience, like I know the person who had like that surgery never was asked like, when are you going to schedule your follow-up for this like major surgery, which just, not to belabor the point, sounds psychotic.
That's me. There's so many places, especially on the where is something. Yet dental is, as you said, it's relatively routine. It's relatively, in most cases, low risk. It's these major life events, major when you go into the ER, the major surgery. Often you don't have a caseworker. Sometimes some of the hospital systems are starting to work around having a caseworker that kind of is assigned to you, but they're overloaded. They don't have the time to get a hold of everybody, and that's where it usually gets dropped. And that's what I would love to try and change somehow.
Yeah. And could you, I don't know if you have the ability to get into it more, but could you talk a little bit more about any of the type of experiences that you have had and like how it's going right now?
No, I mean, the biggest portion that we're starting to explore, with Consig is just partnering with really any of the places where they have a patient are focused around the patient experience and communication. So part of what the discoveries we're doing right now is going into and leveraging what we've done with the plug and play program to go in and do problem discovery with folks. The thing I'm finding that a lot of times, especially in the payer and uh, environments, which is, payers, healthcare speak for insurance companies. The providers are really the doctors and nurses. The first thing to do is find a good champion who understands where the problems are, and that you can then kind of partner with them to say, all right, here, look, this is where you have a huge inefficiency. And let's build a model that shows we can take and automate this portion of the workflow, and you're going to go change the number of clinical conversations from X to Y. And by the way, you're also going to actually reduce provider burnout, because those nurses, they didn't sign up to go into nursing to leave voicemails. That's a horrible use of their time. That's not what they want to be doing with their life. They usually joined medicine because they want to talk to patients and they want to work with patients and improve people's lives. So when you take off that stuff, all of a sudden they start getting a lot happier. A good example is actually our Lighthouse first customer, SQM. They were in charge of doing patient follow-up or claim follow-up for the insurance companies. They have a couple hundred insurance companies. They do on order of around 1 million patient follow-ups a year. And they were having the staff do this by hand. And we were able to go in, automate that first portion of the invite, getting what I've talked to you about as the outreach flow. And we ended up saving them the equivalent of 10 FTEs that they were able to move to other portions of the
Wow.
business, scale through
No.
it. It was around it was over a $700,000 a year savings for them in this, because this isn't low wage call center workers. This is folks that have worked in healthcare professional. It's a much higher cost of the people. All this, and we took off all that first touch for them, and the secondary bonus with them was their employee retention went through the roof, because they took the worst part of the job off them on that side, which was getting people on the phone, asking them if it was a good time. And the data is there. It was like 80% of the time when they did get connected, it wasn't a good time. They needed to schedule a callback. People say, even when they were doing a follow-up on a claim, someone says, I don't want to talk about that right now, whatever. So we were able to take and automate 80% of the calls that they were having to do by hand.
Yeah. Oh, wow. That's pretty cool. And what would you say is, I got to ask, because obviously you're not in the States. Would you say that by the way, these problems are more universal than we'd imagine? I know we mainly talked about the States. Do you have any, I don't know if you know people you said you're in Lisbon, so that's Spain, right? No.
Well, it is different in there. It is, I'd say
Mm-hmm.
I do believe it is universal
Okay.
across. The dynamics are slightly different because when you go in, the different country health systems, the metric, the behavior and everything is very, very different with how you go through it. Just by example, in Portugal, you actually have a lot more access to the doctor when you go to the doctor than you do in the US. In the US, you
Really?
go at your visit, you see a, physician assistant, it gets all your vitals, and then you get like 5 minutes with the doctor. And that has to be like your intense element around it. When I book an appointment, I was actually blown away the first time I booked an appointment with a doctor, because there wasn't a nurse. There was no physician assistant.
Really?
Literally just go into the doctor's office and,
Hmm.
I had a half hour with him. And it's the time, without my appointment slot that was booked for that was my time. And you're just talking with the doctor. There is no assistant. And it's
Hmm.
a completely different type of interaction. I will say the follow-up is not very good. Nobody did it is a case where nobody does any sort of follow-up. That part's not there. But the actual sort of patient-doctor communication is much higher bandwidth, because I actually have a half hour that I can go and ask questions, and they go through it.
It's a much longer period of time.
Yeah, it's a complete. I remember, like, the thing that really blew me away was when I leave. He's like, yeah, if this isn't working, don't worry about getting an appointment. Just come check, knock on my door between appointments. Come back by the office. Because it's hard. I know it's hard to get an appointment. Just check in, and I'll grab you for 5 minutes if this isn't working next week.
Really? That's nice.
It was a completely different piece. So I do think, coming to it, the way the follow-up problem exists universally, but as the patient experience, it is different. It is very different regionally. And I think that's just, unfortunately, the US system is the US system.
Yeah, no, interesting. I'm glad to. I like that context. That helps me out. I wasn't aware of that. I mean, I remember I broke my, or not broke my ankle. I sprained my ankle really bad when I was in Rome, and it was actually a pretty interesting experience, that whole thing. But I have never had any healthcare outside of the States besides that one instance. So very interesting. Are you primarily focusing on the U.S. market though?
We are
For
focusing. We are
okay.
really focusing as the first place, the U.S. market
Mm,
is where I think there's the biggest impact. Around us, and it's just there's more dollars spent in the U.S. There's more opportunity to save. But I sometimes joke healthcare is a target-rich environment for this type of stuff. So it's hard, but maybe it's crazy. I like to try hard things and go after it. So.
yeah, totally fair. What do you think is the next big thing that you'd like to implement to your product to make it better?
Well, I think the next piece around this is taking the core workflow that we've built and making it much easier from an integration perspective. We're building a set of out-of-box connectors so that we can basically get a customer up and running in a couple days, a couple weeks, instead of some of the longer onboarding stuff. Right now, it's gotten pretty quick. We can go through it, but we really see the integration stage that everything's in there is a key portion. The other portion, and I didn't really touch on this earlier, is the whole, and where we say there's a big difference around this is all the compliance. Healthcare is such a compliance driven industry.
Sure.
And what we've been building out is a compliance engine that handles all the different regulatory rules. So let me give you, what does that mean? The US is this crazy hodgepodge of different rules in every state. You have standard rules about making phone calls that have been around for a long time, kind of table stakes. You have healthcare rules that can vary state by state. My go-to example that I find crazy is if you're in mental health and your therapist calls you for a follow-up or something like that, they actually can lose their license if they treat you and you're across state lines. That's actually
Wow.
traveling on vacation, they are not allowed to have any clinical conversation with you. Uh, and how strictly this gets followed, it varies place to place, but especially for the big health systems and big health groups, they really have to understand this. Uh, and then we have the right now whack-a-mole world of AI rules that are coming into it. Every state is passing their own versions of this. Uh, there's about 500 different little rules around AI and communication going in place. And a big portion of what we've been building out is a compliance engine that which basically enforces the different rules depending on where the patient is, why you're
Mm,
calling, are you doing clinical versus administrative conversations. You may have to give one set of disclaimers if you're calling someone in, let's say, Utah. I'll give you an example. They just passed a rule in Utah. If you're having a scheduling conversation and you have generative AI in there, you just have to answer that, yes, I'm generative AI in a voice interface if it is there, if the patient asks. However, if it's clinical and you go down a clinical path, you actually have to get affirmative consent from the patient that they know generative AI is in that conversation.
really?
And mapping
Okay.
this for every state and every scenario is crazy. And so this has been the big place that we've doubled down and built out as a core engine around this. So
Interesting. So, kind of to get some more context on where you think this is going to head, how do you feel like there's no goal here to replace anybody in the healthcare space, right? Like, not, well, that was a little too targeted. I mean, a lot of people are talking about how, like, oh, how is AI going to impact jobs? How do you think practically this is going to impact jobs? Do you think it's going to just make it easier for healthcare workers to do more, that are more and have better care than anything?
so this is a big question, and this is actually one of the reasons why I kind of really liked the idea of working in healthcare.
Sure.
Is this is a spot where there is not enough human capacity to provide for it. Uh, there aren't enough doctors, there aren't enough nurses. We have a shortage, and I fundamentally believe that this is a spot where we can deploy this technology, allow it to scale, and let them do a lot more care rather than cut the number of providers. Now, we live in a world of we live in a place where there's going to be some places where they try and cut corners. Cost is trying to be reduced, but the conversations we've had with our customers at this point, it's not about cutting people, but it's letting them scale what they can do.
Good. No, that makes sense, and I'm glad to hear that. I think a lot of people are probably concerned about that, to be honest. And
I am. I mean and I think in a lot of industries, that's a big element. Now, there's certainly, I think, health portions of healthcare that are probably susceptible to some of that as well. Uh, but we it's a challenge as we think about all of this side. So
no, totally. And I don't blame you for I just appreciate you for the honesty and stuff, because I think sometimes people are like, oh, they'd act like it wouldn't occur, and especially in a healthcare industry, I do think that's probably a big concern of the average individual, right? Is that like they're already kind of skimping.
listen, this seems honestly an area that's there's some of the use cases you talk about people get very nervous about. Do you want an AI model deciding whether to reject claims or not? Do you want a AI model saying that's right? And there's a ton of use cases and stuff that I look in healthcare and I say there is some scary stuff to figure out. And I fundamentally feel like healthcare is a spot that you need humans. Because ultimately care, I really do believe, is human. Now, machine and AI can do a lot of things and help, but I get nervous when I see some of the applications on that side around, allowing access to care or not with AI.
Well, let's talk about that a little bit more then. I think it's a good probably transition into this other topic, because I appreciate that candor. What is the other kind of areas that maybe we're not talking about where there could be concerns with AI, or where do you think it might head, right? In this context of, what the healthcare providers and companies, bigger healthcare companies, like not the providers. The providers, I think in pretty much all cases are kind of exempt from this conversation as to culpability. But where do you think kind of the concerns are for this industry and how AI could be used?
I mean, I think that one of the challenges, and you see this is, and I could kind of opened with this, you do have this now battle of AI on both sides of where the providers are using AI to figure out how to bill the most expensive code and the best revenue health code to the insurance companies. And the insurance companies are looking at AI to try and stop that and make sure that things aren't overbilled. And this is one of those areas I look at it, I'm just like, I think we're trying to solve the wrong problem here, because it's not actually about improving patients. It's not trying to make it more efficient. It literally is just about the revenue battle between these different entities. And that side, as an outsider, fits strangely with me. I understand the financial incentives on all that. The one that probably sits the biggest question to me is use of AI around claim processing. On one hand, it's it's a very manual process, but I really feel like a denial, if someone's going to deny coverage, that shouldn't come from a model. That needs to come from a person.
Yeah.
Yeah. I listen, I'm now just speaking as a individual
As a
and
dude.
person
Yeah.
on it. And,
Yeah.
but that to me is one of, and I've had conversations with folks in healthcare. I'm like, if you ask me, is it good for healthcare to be able to use AI to approve? Absolutely. Use that to scale that, but make sure that a human is in the loop on a denial or when you're going to do something bad, and make sure that to me is the important part, is can we actually go through and deploy AI responsibly, that you're not, yeah, you're speeding things up and then making sure that now the people can actually look at the tough cases and evaluate it the right way.
Yeah, there are people on the other side of this, so that's definitely something to note, and I appreciate you for bringing that up. So no, that's fair.
It's a tough bit, and I understand both sides of this, but that's the spot that gives me the biggest heartburn when I think about how this technology goes into play over the next several years.
Yeah, no, fair. And just to kind of follow up with this, what do you think is the, on a more positive note, what do you think in the grand scheme of things, something that could be your vision for what kind of positive impact you'll make in the aggregate on the world of healthcare in the next 3 to 5 years? What would be perfect world? Who's using your product? What's the outlook?
In my perfect vision, every patient gets follow-up conversations from their providers and the professionals in the healthcare. That doesn't happen now. There isn't. Most people never get followed up, and that would be my perfect vision: is that someone checks in, sees how you're doing, and actually can help you when you're not. Do it in a good spot.
Yeah, no, that's fair. Totally agree. I can't quite imagine this will be easy, right? I do think there's a lot of barriers to entry. I do think there's a lot of, what do you think is the biggest barrier to entry and for stopping that vision?
The biggest barrier is just the complexity in healthcare. The IT systems are all very fragmented. The data doesn't flow from one place to the other. So I think that in some ways that's going to be the biggest challenge to adopt this, because it's not always a simple drop in one piece around. There's no one system of record that usually has everything, unfortunately. That I think is in many ways the technical barrier. I think on the adoption barrier, it is going to be trying to figure out and align things to the financial incentives to go through it. But I do think the incentives on the provider side, the incentives on the payer side, they do exist, but they're not necessarily well prescribed in a way that is easy for people to understand.
Okay, fair. What do you think is a specific thing that you'd like to bring to your product that you don't have right now?
There's always a ton of those pieces.
Everyone's got a big list. I'm familiar.
For us, the biggest thing is pushing forward on getting as much real time on the compliance engine side. We've got a good portion of it mapped out. That's been a real good element, but now really taking it to the next step of really driving where that can be a core engine of figuring out when to call people, when is the right time to contact the patient. That's going to be the next big pieces, is managing that whole data side.
Yeah, fair. And what do you think, just in general, taking a step back outside of healthcare, what are some of the things that you are excited about? I know we talked a lot about concerns. What do you think are some of the things you're just genuinely excited about for how business is going to be conducted moving forward with AI in the next couple of years?
Well, I fundamentally, I do think there's huge changes in across the board how stuff happens, whichever industry you're going through it. Some of those changes are going to be painful. Some of them, I think the other side is much better. Example from a software development perspective, I see how much quicker we're able to get out first versions of features to validate that we're solving the right problem. There's a lot of places where I think the time gets wasted, resources get wasted waiting to figure out if you've solved the problem the right way. And that's part I get most excited, when I look through the tech side, is we're now able to iterate on ideas so much faster than we were able to before. And from a product development perspective, our product manager that's working with our customers can get a prototype version of it and put it in front of them in hours or days, as opposed to having to wait a couple sprints to be able to get development time to build something that is probably wrong the first time anyway.
Yeah, no, totally. Awesome. Well, I appreciate all the insights, and I think we've kind of discussed what you guys do, what you think about the market, but for kind of a closing statement on a positive note, what is your favorite AI for personal use right now? A lot of interesting answers I'm getting on this. Every founder I talk to has a different one. So what do you using on a and if you could try to stray away, I mean, if you really like one of the models, let me know, but if you try to get more niche than just a model tool, I think that would be cool too.
That's tricky. So I still struggle with how to actually balance. There's some things that still drive me crazy that hasn't been integrated. I've been a huge Chat GPT user from the beginning. Uh, and I do, it has most of my history and context in it. Google and Gemini have stepped up quite a bit. I'm finding I often put my biggest challenges in both to see what gets better answers, and then whichever one is going the right direction, I steer towards. And I've ended up going down the Gemini path a lot more lately.
Gemini is incredible.
It's it's shifted. It's completely different from what was just a little bit of a toy once in a while to now it's actually where I end up more often. The part that frustrates me to no end is still all of these tools integration into my data sets. Nobody really has solved how to look at my email, how to look at my drive, how to look at my context, what's the distilled knowledge of record that it actually should be basing decisions off of that. And that's the part that for the love of God, I think they're going to get too soon. And I think, Microsoft with sort of the Office 365 and Google are kind of in the dominant spot to be able to leverage the integration, because it really is, how do you access data in the right side, but nobody's got it right yet.
Yeah, no, that's fair. And I really like the multimodal capabilities of Gemini. We actually just created a cool workflow utilizing Gemini that has the ability to like QA video edits, which is crazy. It's like insane to me how, because I had come up with I just did another interview right before this, and I was acknowledging like models. There's a couple angles I usually go into podcast depending on the person that we're talking to. And they're more of a different type of product, where I could imagine model limitation causes some issues. And it was so crazy to me because I had come up with this idea to QA videos through video multimodal capabilities in June, but there was no model in the market yet that could do a good job. And then I saw a stat where Gemini's screen understanding and video understanding was like a 77% benchmark, and the next highest one was like 20% or 30%. And I was like, okay, clearly this is going to be like a big improvement. And I just took the same thing, and in 2 hours, I tweaked the automation, put in the new models, whatever. And then I'm like, my video editing team's like getting automatic quality assurance based off of a course that I taught them on how to not only like how to do it better, or not only how to fix mistakes, it's also like, well, you should probably put this type of thing here to make the edit look nicer. I'm like, holy crap, man. I'm like, we're really moving forward. So that's why I like to ask that question. Everyone's got something cool they're working on in this realm. So it's really exciting to hear what you got going on.
I'll say the biggest change in the last couple of months, though, has actually been the integration of speech. I used to have to type all my emails. I'd say 75% of my documents now are transcribed using some of the new tools that are out there. My favorite one is actually Monologue from Every. They did a great job of integrating into the Mac. They do a really cute hybrid piece where it's not just speech to text, not just speech transcription. They're running it through app-specific context prompts, as well as effectively using the screen context to see everything that's on your screen, so it gets a much better result. And it really is a good example of taking all the different modes in there of what app you're in, what's on your screen, and your actual voice. And it is an amazing experience for that. It's let me go.
It really is. So with that being said, could you let everyone know where to go in order to check out what you're doing at Consig?
Yep. You can take a look at our domain at consig.ai. Feel free to reach out to me on LinkedIn. If you search for RJ Burnham, it should be pretty easy to find.
Awesome. Well, thank you so much for being on the show, RJ. We appreciate it. Thank you, everyone, for listening. Make sure to leave a like, review, and don't forget to subscribe to the YouTube channel. That goes for you as well, RJ. Get all those cool updates, review the podcast, get yourself some more listens. We'd really appreciate that, and we really appreciate you for being on the show. So with that being said, everyone make sure to go to consig.ai. That's consig.ai. Thanks for watching, and we'll see you in the next one. Peace.